Makakasama natin ang ilan sa mga eksperto pagdating sa pananaliksik ng mga datos at impormasyon na may kaugnayan po sa COVID-19. Nang sa gayon po matukoy at hindi lamang ng ating pamahalaan kundi pati ng pribadong sektor ang tamang pagharap po sa krisis na ito. Welcome po sa aming programa, sa ating programa, Dr. Butch ng OCTA Research Group. Good morning po, Doctor.
Good morning at good morning sa ating mga nanonood at tagapakinig. Ako yung nagagalak na inibitahan niyo ako for today's updates.
Sa inyo pong inilabas na report noong September 6 ay ipinakita ninyo na nagsimula na po mag-flatten ang COVID-19 curve, partikular po sa Metro Manila. Samantala, batay po sa inyong pinakahuling ulat nitong Sabado ay nagkaroon po ng downtrend sa kaso ng COVID-19 sa bansa, with 0.82 reproduction number po mula September 16 to 23 at transmission number na nasa 0.74 as of September 23. Ano-ano na po ang mga naging factors natin para ma-determine po o maibahagi sa publiko ang ganitong projection?
Kung naaalala nyo, noong bandang umpisa ng Agosto, nagkaroon tayo ng mungkahi galing sa ating mga healthcare workers for a time out, no? At ito ay napagbigyan ng IATF at nagkaroon tayo ng 2 linggong time out. At ang nangyari dito ay mula nung nag-time out tayo, nagkaroon tayo ng MECQ, no? Steadily bumababa ng ating number of new cases. Before the time out, we had almost 4,500 to 5,000 new cases per day. And then we instituted the MECQ, and right after that, we began seeing a downtrend sa ating mga bagong daily new cases. No? Bagamat ngayon, nagkaroon tayo ng slight increase ng ating daily new case, pumalo tayo ulit sa 3,000, no? As reported lately. We are still holding the reproduction number below 1. Ito po ay magandang balita, no? Kasi ang reproduction number, ito ibig sabihin na ito yung ating transmissibility number, meaning reproduction number of more than 1. Ang ibig sabihin yan ay actively transmitted ang virus in the communities. And then our value or reproduction number below 1, it means that it is now being controlled, no? Hindi na masyadong kumakalat sa komunidad. Currently, ang reproduction number ng Pilipinas ay nasa 0.80 to 0.85. Ito ay magandang senyales na ang ating yung infection natin sa komunidad ay bumababa na steadily, no? And sa NCR naman, tama kayo na sa pagsasabi na ito ay ang epicenter ng COVID-19 sa Pilipinas. Sa NCR naman ay gumaganda na rin ang ating reproduction number, no? Nasa 70s. I think 0.77 ang reproduction number ng NCR, no? So ang downtrend na ito ay ating sana, no? Masustain natin ang downtrend, no? Even if nakikita natin na medyo may konting fluctuations up and down sa ating daily reported new cases, we should maintain our minimal health standards, wearing of masks, for example, social distancing, wearing of face shields when we go outside, no? And staying home if there's no necessary reason to go out, no? All these standards, minimal health standards, have contributed to the decrease in the reproduction number. In fact, there's another medyo magandang balita na rin, ang positivity rate din ng NCR. That's how many positives are found for every 100 tested, no? It's at 9%, no? Ang una naming target is 10% for NCR, bumaba na to 9%. Yung WHO, ang target niya talaga for positivity is 5%. So papunta na rin tayo doon, no? Nagkaroon tayo ng positivity rate of as high as 14%, now it's down to 9%, no? So kung meron man panahon, kung kailan tayo magkaroon ng mas strict na disiplina, mas strict tayo na sa sarili natin. Now is a time, no? Ngayon na pababa na. Huwag na natin hayaan ang ating gains, ang ating benefits for the last month and a half. Ever since we began the MECQ, no, we should still maintain the minimal health standard, no? The downtrend is encouraging, but the message here is it can actually surge at any time. So ang ating stopgap dyan, ang ating pinaka dahilan to control it is our discipline. In fact, I believe that everyone knows what to do. No? Hindi naman nagkurang talaga sa pag-uulat o pag-communicate kung ano talagang dapat gawin. And I think everyone knows what to do. And ang ating disiplina sa pagsunod nito, perhaps we will see a further downtrend to 5% for the positivity rate and further down to 0.5 our reproduction number, no? And perhaps at that time we will see a further easing of the quarantine restrictions, no? And as you know, the president has announced the restrictions lately, and this is to sustain the gains that we have had in August, in September, no? It will sustain it, the downtrend, until October.
Opo. Doc, yan nga po yung susunod kong tanong sa inyo dahil dyan nga para masustain po yung positive trend na ito ng pamahalaan, pinaalalahanan nyo po yung ating gobyerno na panatilihin po yung sa ilalim ng General Community Quarantine. As you said nga po, sinabi na ni Pangulong Duterte, kasama po yung National Capital Region, na ito po yung tinatalang napakarami po ng mga naitatalang kaso ng COVID-19. So sa palagay po ninyo, hanggang kailan po nararapat na manatili under this classification ang National Capital Region? Bakit po?
Alright. Ang obserbasyon po namin sa research group namin ay every 2 weeks nakikita namin yung epekto ng quarantine restriction, no? So ibig sabihin nung humingi yung mga doktor ng time out nung umpisa ng Agosto, no? 2 weeks later, nakita yung gains nila. So nag-time out tayo for 2 weeks, and 2 weeks later, pagpasok ng Setyembre, nakita natin na bumaba na ang number of new cases at bumaba na ang ating reproduction number and positivity rate, no? So the recommendation still follows the 2-week period of observation and monitoring. So kapag in-announce o in-anunsyo na maintain ang general community quarantine, no? At the very least 2 linggo ang ating observation noon, no? And at the end of 2 weeks, sa medyo bandang first 2 weeks of October or first week of October, kung nakita natin na bumaba na further to 5% ang positivity rate, and further down to 0.5 or even less ang ating reproduction number or yung R value, no? Perhaps we can ease the restriction, no? But for now, no, we cannot say, as I've said a while ago, at any time there could be a slight increase or uptrend, no? So nakita na natin in our report today na pumalo na uli sa 3,000 per day ang ating new cases. Naibaba na natin sa 2,000 plus, no? So let us try this week and next week. Let's try to maintain the positivity rate or even lower the positivity rate, maintain the R value, no? So 2 weeks ang recommendation ko sa maintain ng ating current quarantine restriction. After 2 weeks, mag-decide uli, no? Depending on the trending that we will see the next 2 weeks.
Opo, Doc, what do you mean daw po nung sinabi ninyo yung possible trend na po ay irreversible? Aside po sa mahigpit na quarantine measures na ipinatutupad, ano-ano pa po ba yung significant efforts na maaaring gawin para tuluyang mapababa talaga yung kaso ng COVID-19 sa buong bansa?
As we know, no, yung mga natetest na positive in the community, ginagawa nila ng contact tracing, no? Ang mungkahi ko, ako ay isang doktor, no? Ang mungkahi ko sa ating mga kababayan ay kapag merong dumaan sa inyo at nag-contact trace, no? Mag-cooperate po tayo, no? Tell the honest truth about what you're feeling and where you have been and who you have been in contact with, lalo na kapag may biyahe kayo sa isang hotspot area, no? So ang aking mungkahi dito ay yung ating contact tracing. Dapat ma-maintain natin or even add our contact tracers, no? Add the efficiency of our testing, our RT-PCR and other testing facilities, no? So with these factors, no, we will be able to see a greater picture. We will be able to see a better trending, no, in our projections, no. Pero ang nangyayari naman ngayon ay gumaganda naman talaga ang ating reporting, no? And gumaganda na yung ating trending. So i-maintain lang natin what we have now, no? Our hospital capacity has improved. Meaning to say, yung ating hospital ay hindi na ganoon kapuno, no? Although the hospital capacity is set at 70% utilization. So 70% of beds is their red marking, no? So sabihin danger zone na pa nag 70% yung utilization. No? Bumaba na to 60, 50s to 60. So gumaganda na, no? So even our hospitals are already feeling the gains of the improvement. No, our communities are feeling the gains of the decreased number of new cases and decrease in the positivity rate. No, all we have to do is sustain it. It's just to maintain it. No, we should not do anything drastic. No, we should not suddenly open economy wide. No, we still have a few more weeks to go of improve or increased discipline sa sarili. No. I'd like to note also that one of the things na nakikita namin sa communities is yung mga trends in exchange of money. No, doon talaga dumadami din yung number of cases. So going cashless, no, ginagawa na ngayon nga sa economy, no, going cashless, and kapag kumuha kayo, nagbayad kayo at walang barya, always wash your hands. That's one way we can curb the transmission in the communities.
Opo, Doc, may mga gusto pong itanong ating mga samahan sa media. Si Evelyn Cruz po ng Filipino Mirror, ito po yung question niya. 3 weeks ago, Dr. Guido David of the UP OCTA team stated that the curve of COVID-19 infection has already flattened. Given the figures at present na more than 300,000 and rising, would you say that his statement is still true?
When you talk about flattening the curve, we are going. We actually mean flattening it against the hospital capacity. You know, ibig sabihin we have to flatten or lower the number of new cases and lower the number of infected individuals in the community, so that our health capacities can, or our healthcare workers, our hospitals, our wards, our ICU can take care of those who are sick. No? So now that we see that the hospital utilization is going down already, no? So ang ating curve ay naka-flatten in a way, naka-flatten, no? Pero ang mensahe talaga namin is this: yes, it is maintained at the flattened rate that Dr. Guido has mentioned, but it can still increase at any time, no? The only way we can control it is by maintaining the R value, no, the reproduction value. It's now at 0.77. If we can maintain it to 0.5 and lower, that will surely bring the curve down to a very, very controllable state. No? The positivity rate from 9% to 5 and below, that will further flatten the curve to the ideal level, such that perhaps at that time we can now begin to open economy some more. We can begin to release the quarantine restrictions further. No, so we are going down the number of cases, no, the positivity and the R value. No, so the curve is already beginning to flatten. No, it is not flattened yet to the ideal. Again, the WHO says the positivity rate should be 5% or lower. No, so we are flattening it already, but still not within the ideal rate to release the restrictions.
Opo. Question naman po from Jillian Cortez ng Business World. Ito po tanong niya, is it possible that the Philippines will remain under lockdown until the end of the year or even next year with the rate of cases now as its Asian neighbors already reopened totally their economies? The Philippines has been on lockdown for over half a year already.
Okay, I'd like to redefine lockdown. When we say lockdown, everything is locked down to the home. No? Everything, economy is is almost put at a halt, and we had that during ECQ, no, at the earlier part of the year. No, now it is now economy is opening up a little bit. We are no longer on the strict lockdown that we were talking about. Now we have to shift our definitions. No, what is a lockdown? For me, that's when we had ECQ, when we had a strict ECQ. Now we're into GCQ, which is a more relaxed restriction. No? So to answer the question, until when ba talaga ang ating expectations ito? No? Again, no? we should look with a let's say a microscopic or everything in a microscope, no? So every 2 weeks dapat ang ating pagtingin, no? So when we had our projections 2 weeks ago, nakita natin na bumababa na. Now we're saying to maintain the general community quarantine, we look at the next 2 weeks kung bumababa na. Everything points toward improvement. But we have to look at it every 2 weeks, no? We cannot make a general statement na by Christmas wala na lahat, by December okay na, normal na. And even if it's normal, even if we're COVID-free on December, a new normal must happen, no? People should be more careful. People should wash their hands, keep disinfecting surfaces, no? So that's the new normal, no? So we should look at the situation every 2 weeks. Look at the trend every week and every 2 weeks. No, everything is looking at a very positive outlook. No, for the next 2 months. No, but again, baka mamaya mag-increase. I'd like to cite an example of other countries. Let's say New Zealand. Though they had a COVID-free pronouncement about several weeks ago, to a month or 2 ago, COVID-free sila. Bigla nagkaroon after 100 days of being COVID-free. So ayaw natin ng ganon, no? So we are learning from the lessons from other countries. No? So take it step by step by step. Take it weekly, every 2 weeks, every month. No, I cannot make a general statement that by November 5% na ang positivity rate. No, in dealing with the science of the pandemic, we should be careful. We should look at the trend. We should look at what is happening now and learn from the past, and of course learn from other countries. So the answer there is we'll look every 2 weeks.
Opo. Yung second question po ni Jillian Cortez ng Business World, DTI Secretary Lopez said more industries can operate at 100% capacity. Is this safe to do so considering this will be more people in commute and in public areas? Will we see more cases this way?
We should still follow the minimal health standards, which includes social distancing. If the facility can guarantee, number one, that everyone inside there will have effective social distancing. Number two, proper ventilation. You know, the occupational medicine and safety community, no, they have already determined that proper ventilation in the workplace is essential to curb the transmission in the workplace. No? So if we have a 100% back to normal situation in our industry, in commerce, no? If the minimal health standards cannot be guaranteed, then we should not be at 100%. No? We should do it slowly. No? Actually, tama din naman ginagawa. No? Initially, 30% lang, then 50%, then 70%. No? And we should always look at the science. We should always look at the trend. No? Only then can we safely and confidently say that pwede nang i-release ang restriction, pwede nang back to 100%. No? So right now, this is my personal opinion, that going 100% in industries which have a lot of people working closely together with interaction every day with each other is not recommended right now. No? Still follow the rules of GCQ, still follow the social distancing, masks and the washing of hands, no, in the workplace.
Okay. Maraming salamat po sa inyong panahon, Dr. Butch Ong mula po sa OCTA Research Group.
Maraming salamat po.